So why did I choose Rush for my residency? First, the city of Chicago is just such a wonderful place. I've loved living here for the last 2 years. There's so much to do, and the diversity of the city is truly remarkable in taking care of patients from all walks of life. And then Rush as an institution is just a wonderful place. It's revered in the city as a place where excellent care is given, but then you just serve people from all walks of life. It just is really a profile of the city, the patients that you take care of here. And then specifically the Rush Peds program, it really is a family here, co-residents. We spend a lot of time together, just finished going to a lot of weddings, and it's really, the size of the program is truly like a family feel. I know we'll be lifelong friends. And then working with the attendings, some of them are sitting around the table here, but it really is a collegial environment that I think is unique. You're treated as a peer, even as a resident. And so I've learned so much from the attendings that I've worked with, but also feel really respected. So it's been great.
So the reason I picked Rush, when I first interviewed here, I really felt it was one of the only places where I felt like the residents were genuinely happy, and they were very transparent about what they liked about the program, what they didn't like about the program, and I really felt their closeness and how supportive they were of each other, and that hasn't changed since we started residency here. We have a mid-sized program, so it's big enough that you can still sort of learn about people as you're going through. It's not too small that we don't have issues with coverage, but it's I think small enough that we're all very close. We spend a lot of time outside of work together as much as our schedules allow, and we really are very supportive of each other even when we don't see each other on a regular basis. And to that same effect, I think on difficult rotations that are very demanding, we all kind of have the same work ethic, that we're all taking care of the patient, trying to provide the best care for the patient, but at the same time trying to take care of each other and really looking out when certain residents may be struggling. And then to that same effect, I think our program is very receptive of what the residents feel are the maybe some of the cons of the program, and really pay attention to resident quality of life. There have been so many changes that have even been implemented since we've started about 2.5 years ago, from when we started as interns till now, and the residents have a huge say in sitting in on meetings to do with curriculum and quality of life. The program directors and residents and attendings really listen to what we have to say and really make changes that have been very beneficial.
You know, being in a mid-sized residency program as a subspecialist, I think is actually phenomenal, right? So we go into whatever subspecialty, certainly for the disease states, but a lot of us really want to be an educator. And I think Rush is kind of a remarkable place that we know coming in here, we don't have a whole lot of fellows, right? And so there is a lot of direct interaction between the residents and the attendings, which is why a lot of us kind of choose this size anyway, because we like that interaction. We like that direct teaching. You know, there's a ton of opportunities for residents to do the procedures that in larger places would immediately go to the fellows first. And so I think having those kind of additional opportunities for to teach, to educate, to try to inspire, the next round of people to go into what we like doing is fun. I think Rush also does a good job of incorporating subspecialists in a lot of the residency kind of programs in terms of the curriculum committee, those types of things, and part of that, which just helps kind of shape what is going on in the curriculum that the residents are going through, addressing issues that are coming through the subspecialty rotations, just being able to kind of keep a pulse on kind of what's going on, what issues are, and how we can help change and help those rotations too. I think there's a lot of opportunities. I think the best part is obviously the interaction that we have between faculty, fellows, attending, residents, students, and of course patients and families.
I wanted to talk a little bit about the clinic. Our clinic is an amazing place. It's, we have the largest general academic pediatric practice in the city of Chicago. And because of that, it is a robust learning experience. There's plenty of patients, and they come from all walks of life. The demographics of our patients really reflect the city of Chicago. I spend about a third of my time speaking Spanish with my patients, We have every race, every culture represented. It's a really remarkable variety of patients that we have. We take care of a lot of patients who are not very well off. We also have plenty of patients with private insurance as well. We have every cut of the city of Chicago. And I think the residents and the students really benefit quite a bit from all this. There's a variety of skills that they get by adapting to every type of patient that they take care of. But also within the patient group, we have a ton of complex patients, a variety of patients that get their specialty care at Rush, choose to get their primary care with us. And so it's all within one place for them, but it makes for an exceptional learning environment for the residents.
So one of the things that I'm very proud of that's grown out of our program at Rush is the Global Health project, and that's something that started in internal medicine, but now has grown into pediatrics, and I help supervise that program. So we have residents and students, faculty, all different providers at Rush who go to our global health sites. And residents can join a track where they're part of the global health project for the full time of their residency. They'll go on multiple trips, do a project, really get involved and learn a lot about global medicine. But our residents also can do an elective month. They can do a 1-week trip just as part of their overall training. And so these opportunities take our residents to Haiti and to the Dominican Republic, and it's really neat to be able to be a small piece of a program that's providing a continuity of care to our patients in these underserved areas.
First, I want to start by saying I've been at Rush for 20 years, so I've been here a very long time. This was my first job out of residency, and I've really seen the residency program change and grow and really become a very solid, wonderful program. The mother-baby unit is a particular interest of mine. Our mother-baby unit here at Rush, the average census is about 12 mother-baby couplets per day. We can go up or down from that, and we do about 2,500 deliveries a year here at Rush. The mother-baby unit team consists of an attending, a third-year resident, and an intern, and that's it. So really that resident, that third-year resident and intern really are the primary care provider for that mother-baby couplet and really helping that family transition to having a new baby at home. They do everything from the admission to the daily care of the baby to the discharge summary and follow-up. What's really nice is that our continuity clinic, which is right across the street from the hospital that Dr. Quinlan already spoke about, is where most of our babies follow up. The continuity clinic is a very busy place here on the campus. One thing that's very unique about the continuity clinic is that it's 3 clinics in one. The attendings have their own patients that they see within the clinic. The residents have their own continuity clinic within the same 21 rooms. And the acute care clinic, which is sick visits every day, is also within those same 21 rooms. So 35,000 patient visits a year, all within the same 21 rooms and space. So it's really a close-knit group over there. The residents get to know the nurses, the medical assistants, everyone who works there, and it's a big team effort. So we really enjoy the family atmosphere of the continuity clinic.
So why did I choose Rush? Well, it was really easy. Wellness was a hot topic when I was applying to residency programs, and Rush was the program that got it right, in my opinion. Since I've been here, I have had the pleasure of working with all of the third-year residents who make sure that us interns get a little bit of sleep when we need it, and that we stay happy on our rotations. And I think that it really adds to the sense of family and togetherness. And I am really happy with the decision that I made and that I matched here. Yeah.